Hi everyone, today I want to share my opinions about the relation between high protein diet and kidney damage in people with pre-existing chronic kidney disease. I recently watched some videos about this topic. I'm surprised that a lot of content creators in this area believe high protein diet is no harm to everyone, including people with chronic kidney disease. Even the famous YouTuber with millions of subscribers share the same opinions and claim there's no scientific evidence to support high protein diet is detrimental to kidney of people with chronic kidney disease. I cannot agree with this. I want to remind the health risk of high protein to people with CKD. I think it's well accepted that a high protein diet is harmful to individuals with existing kidney disease. As early as 1982, after analysis of animal models and the patients with coexisting kidney disease, Branners proposed increased glomerular filtration and glomerular pressure cause kidney injury and potentially increase the risk for or progression of renal disease. Now the glomerular filtration rate, GFR, is widely used to measure the kidney function. More and more studies confirm the Branners hypothesis. I will briefly talk about some of those studies for your reference. A cohort study of over 1,600 women by the Nurse Health Study found the protein intake was significantly associated with a decrease in estimated GFR in women with mild kidney insufficiency. The trend is not observed in the healthy women group. There's also another interesting result in women with mild renal insufficiency. Those women who have high intake of non-dairy animal protein suffer more in GFR decrease. This might help people with CKD to choose the right source of protein. In another cross-sectional study including more than 500 adult patients diagnosed with stage 3 to 5 CKD, a significant correlation between high protein intake and the decrease in GFR was also reported when comparing with normal or low intake. You might wonder why high protein works differently between healthy people and people with CKD. As I mentioned in my previous video, when we take a large amount of protein, there are some acute changes in kidney, such as the size of the kidney, the glomerular pressure, and the filtration rate, and the nitrogen waste excretion. The kidney will get busy, but these changes are well within the functional limit of a healthy kidney. When it comes to a CKD patient, the case is different. The functional limit of a dysfunctional kidney is smaller. When the bar gets lower, the adaptation decreases. So it is reasonable a progression of CKD was observed for high protein diet patients. Even though there are some limitations for those cohorts, it is enough to raise the alarm for the protein intake among CKD patients. I will strongly suggest people with CKD get advice from your doctor if you think about changing your protein type or elevate your protein intake. That is all for today. Feel free to share this video to anyone who might get a benefit. If you like my video, please subscribe my channel. I will see you in next video.